So in today's session, we will be discussing on the topic of kidney disorders, kidney diseases, not from the textbook. Okay, these are just additional classes. So if anyone is joining late, please help them out with the topic name. So kidneys, they are the vital organs that filter fluid or filter your blood. Okay, waste and other fluids unwanted out of your blood. Okay, and you cannot survive without a healthy functioning kidneys. Okay, so there are certain diseases that lower your kidneys ability to do this function, filtering out your blood. Okay, and if this function of filtering the blood, getting the toxic waste out of your system, if it does not take place, it can harm other body parts as well. It can lead to other diseases as well. So that's why without a healthy functioning kidney, mortality rate is quite high. Okay. So these diseases can lead to chronic kidney diseases, okay, acute chronic kidney diseases, kidney failures as well, if left untreated. Okay. So this nephron, this is the structural and functional unit of a kidney. Okay. In most of the kidney diseases, which we will discuss further, you will see that nephrons are getting affected. Okay, either through some infection, inflammation, okay, physical damage, nephrons are getting affected. So that leads to majority of the kidney diseases, nephrons are being damaged. Okay, and this damage could be through genetic problems, okay, autoimmune disorders, certain traumatic injuries, okay, you get hurt in your kidneys, you get a gunshot wound, stabbed wound, okay, certain medications, overdosing certain medication, the toxicity of certain medications can also damage your nephron because the main filtering activity is taking place in your nephron. Okay, with other coexisting diseases like diabetes, high blood pressure, okay, any family member in your family is being diagnosed with CKD, chronic kidney disorder. Okay, so these will increase your risk of developing kidney disorders. Okay, when the kidneys get damaged, waste products and fluids can build up in your body. It causes swelling. Okay, lower body swelling, especially ankles, nausea, weakness, can't sleep properly, shortness of breath. And without treatment, the damage can get worse. And in some cases, your kidneys can eventually stop working as well. Okay. So CKD, chronic kidney disease, is when lasting damage to your kidneys have been caused and your kidneys lose the ability to filter waste and fluid out of the blood. Okay, so there is a waste buildup in your body, fluid buildup in your body, that is edema, swelling. Okay, along with that, waste buildup in the body also takes place. So waste can build up in your body and can harm your health. It can cause further inflammation in your body. So this damage and your kidney function can get worse over time if it is not getting treated well. Okay. And eventually your kidneys will stop working. And in this situation, it's a fatal stage. Okay. It's a final stage of renal disease. Okay. Or kidney failure. You may require transplantation or you will be put on dialysis. So that is chronic kidney disease. So these are the different stages of kidney disorders. Okay. In stage one, it's functioning normal, no issues. Okay. In stage two, there is mild loss of function. Urination, the rate of urination decreases, maybe once a day or just twice a day. Okay. Stage three, moderate loss of function with swelling. Okay. Stage 4, severe loss of function. And stage 5 is kidney failure. So the chronic kidney disease is in different stages. Okay, different stage will have different elements of treatment as well. 1 in 7 adults in America, they have this condition. And in 40% of these cases, people are not aware that they're suffering from chronic kidney disease. Stage 3 also, slowly swelling will start going up. Lower extremities will be heavier, swelling will be there. In stage 4, nausea, vomiting, overall swelling, weakness. Okay. Stage 5, you will be admitted in the hospital. Okay, you will be put on dialysis. Life-sustaining equipments will be put. Next is polycystic kidney disease, okay? PKD. So here you can compare how a normal kidney looks like and how a polycystic kidney looks like. Cyst means what? It's a fluid filled cavity. Cyst means it's a fluid filled cavity. It's a cavity, and cavity is an empty space, but it is filled with fluid. That is a cyst. Polycystic means too many fluid filled cavities are there in the kidneys. That is polycystic kidney disease. So that is genetic disorder runs in the family, and it causes these small cysts, if you can see, okay, on the image. These are fluid filled sacs, okay. They grow on your kidneys, and wherever they grow, they limit the kidneys function, okay. Whichever areas have this cyst, that area will not be able to function properly. Okay, so the ability to filter out blood and other waste is also reduced. Over time, if polycystic kidney diseases are not treated, it can cause kidney failure as well. There is no specific cure for PKD, but treatment can slow the growth of cyst. Okay, you cannot cure it, but certain treatments, certain medications that you can take, it will reduce the number of new cysts that can develop in the future. Okay, so it can slow the growth rate of cysts because cysts don't happen overnight. Okay, it starts as a small fluid filled sac, and slowly over time it gets bigger and bigger. Okay, so it grows day by day. It may take months also to reach a big size. Okay, so there are certain medications that can slow down the growth of cyst. So that is polycystic kidney disease. Treatment we will not discuss here. These classes are just to make you understand different forms of diseases, how they look. Okay, breaking down the name, meaning, medical terminology, name, meaning of disease conditions. Next is lupus nephritis. So this is an autoimmune disease. Okay, here your immune system will attack the healthy nephrons. Okay, your own immunity is going and attacking your healthy nephrons. So lupus can affect many parts of the body, not just kidneys. Kidneys are one of the organ that gets affected. Okay, lupus nephritis or lupus as an autoimmune disease. It can affect your thyroid. It can affect your intestine. It can affect the lymph nodes, your lymphatic system, your kidneys, your liver, spleen. Different organs can get affected in lupus. But specifically, when your kidneys are getting affected, when your own immunity is attacking your own kidneys, it's called lupus nephritis. Okay. There are different types of autoimmune diseases that affects kidneys, and lupus is one of them. Lupus nephritis is one type of autoimmune disease that gets that affects your kidneys. Okay. Again, medication here is usually the principle of management of lupus is to suppress your immunity. Some steroid medications will also be prescribed to suppress your immunity. Then glomerulonephritis. Glomerulonephritis. Okay. Here, glomerulus, that is a part of your nephron. You can see here this area. Okay. This is a magnified version of how a nephron looks like, just a part of nephron. This yellow colored C shape that you see is Bowman's capsule. And under the inside the Bowman's capsule, you can see this twisted and turned capillaries. One is a renal artery that goes in, the other is a renal vein that comes out. Okay, but they get twisted in, okay, knotted, tangled, and twisted in. This twisted in part is the glomeruli. Okay, here, if inflammation takes place at this microscopic level, when inflammation takes place, that is called glomerulonephritis. Okay, it's not that just one cell is getting inflamed. Okay, the entire tissue there, all the cells there, majority of them are under inflammation. Okay, so a part of your kidneys are undergoing inflammation in the glomeruli. That is what we call as glomerulonephritis. So your kidneys contain more than 1 million glomeruli, which are tiny filters. This is where the filtration takes place. Okay, the renal artery that enters, the renal artery that enters the Bowman's capsule is bringing oxygen as well as all the toxic waste from all over the body is brought here. Oxygen will be taken up by the kidney for survival. Toxic waste will be filtered out from the C shape you see here. Okay, a tube is going down. Okay, here all the waste will be filtered out, and the filtered deoxygenated blood will be taken out through your renal vein. That is how the anatomy works here. Okay, so if there is any damage at this glomerular level, okay, your filtration is down. GFR rate, glomerular filtration rate will be down. And if it is not treated, again, it will lead to serious kidney problems, kidney failure, death as well. Okay. So people who suffer from glomerulonephritis, they will have protein in urea, in their urine. They will also have blood in urine, because at this level, when anything is inflamed, okay, this capillaries here is not able to do its job properly because there is an inflammation. So what is not supposed to leave the blood vessel, that can also leave the blood vessel. For example, proteins. Proteins are not supposed to leave the blood vessel. It has to stay within the blood circulation. Okay, but here the protein will leave the blood vessel. It will enter the Bowman's capsule. It will go into the collecting ducts. From there, it will form urine, and it will get out of the kidneys. It will go into the ureters, urinary bladder, and out of the body. So protein is a big substance. Okay, it is not a small. It's not. If you compare protein with platelet, or if you compare protein with your red blood cells, okay, the size of the protein could be 100 times than the size of a platelet. Okay, so protein with such big size, it is not supposed to leave your blood vessels. It is not supposed to come out of your blood vessel wall and get into the Bowman's capsule. It has to stay intact. Okay, so if there is protein in the urine, it means at your glomerular level, something is damaged. The vessels in the or the capillaries in the glomerular level is damaged. That is the reason why protein could escape. Okay, so that's why it leads to proteinuria. And hematuria, just imagine if protein with such big size could escape. Obviously, your red blood cells, your blood can also escape behind through it. Okay, so that's why you get blood in urine as well. Okay, so that is glomerulonephritis. Is it clear to all? Then you have IgA nephropathy. IgA is immunoglobulin A. Okay, immunoglobulin, IgA. There are different types of immunoglobulins. That is immunity proteins. It's a protein that has the function of immunity. Okay, IgA, sorry, Ig, anywhere you see I, capital I, small g, it is immunoglobulin. Okay, IgA, IgE, IgG. There are different types of immunoglobulins in your body. Okay, so IgA nephropathy means there is a specific kind of um, immunoglobulin called IgA. This specific IgA is attacking your nephrons. Okay, it's attacking your kidneys. That is IgA nephropathy. Okay, it's a rare disease caused by kidney damage, which again in your own immune system is producing antibodies in your kidneys, and these antibodies are fighting your own kidney. Okay. In lupus, antibodies are not produced as such. Okay, your own white blood cells may go and attack the kidneys. Okay, but here antibodies are produced. That's an immunoglobulin is an antibody. Okay, when this antibody should be produced when there is a pathogen, when there is a virus, bacteria, fungi. Okay, in this situation, when the microscopic pathogens are entering your body, in this situation, antibodies should be produced to fight that specific antigen. Okay, but here antibodies are produced to fight your own kidneys. Okay, that is nephropathy. Okay, so that this triggers harmful inflammation in your kidney because your kidneys are constantly under attack from your own antibodies. And the inflammation is kind of the natural response of your body to any injury or infection. So when the kidneys are getting injured at cellular level, when the kidneys are getting injured again and again, okay, inflammation will happen. Inflammation is taking place to protect your body. Okay, but inflammation has its negative consequences as well. Okay, so in this process it lowers your kidney's ability to filter waste and fluid out of your body. There is no cure for IgA nephropathy. Okay, but you can only slow down the damage. Damage will take place. There is nothing that can save you from the kidney damage. Damage will take place. Okay, you can just slow down the damage. Okay, that is IgA nephropathy. Because you cannot control your body to make which specific antibodies or which specific immunity should be produced. With vaccination, yes, but without that, you cannot direct your body to not to make any antibody. Okay, that cannot be done. Then you have diabetic kidney problems. This is kidney damage because of diabetes. Okay. Or it is also called as diabetic nephropathy. There is diabetic retinopathy, diabetic neuropathy, diabetic nephropathy. So in diabetic retinopathy, your retina inside your eyes are getting damaged. Diabetic neuropathy, your neurons, the outer layer of your neurons are getting damaged. In nephropathy, your nephrons are getting damaged. Okay. So these does not happen immediately. A person should be like suffering from diabetes from the past 10 to 20 years or more. Then these different types of neuropathy, retinopathy, nephropathy sets in. Okay. It becomes long, the nephropathy and all, the process of this damage has started long before you have developed the symptoms. Okay. So usually retinopathy, neuropathy, nephropathy, these different types of consequences of diabetes are diagnosed much later in life. Okay. You should be like suffering from diabetes from more than 15 to 20 years in that case. Okay. The body slips into these situations. People with diabetes should get regular screening for kidney disease, okay, to catch it as early as possible. So the test that people who suffer from diabetes they should do is regularly get your urine test done at least once a month to detect the presence of protein in urine. If there is protein in urine, somewhere some damage has happened in the nephron. That's why protein could leave the blood vessels and get into the urine. Okay. If there is no protein in the urine, your kidneys are healthy. Okay. You can also slow down the kidney damage or keep it from getting worse by controlling your blood sugar, because when blood sugar levels are high, inflammation will also remain high. Okay. Too much glucose in your blood is causing a lot of inflammation, not just in your kidneys, but everywhere else in your body. Okay, too much of glucose in the blood will cause inflammation, will trigger inflammation. So controlling blood sugar levels are important. Controlling blood pressure is also important. And taking your medications regularly and not eating too much protein can help. Okay, especially once you have been diagnosed with mild to moderate nephropathy, you have to control your protein intake, because when there is too much of protein, that's when kidneys will try to get rid of it. Okay. So that is diabetic nephropathy. Then you have kidney cancer. Kidney cancers, with age, your risk increases. Okay. If you are suffering from certain kidney disorders from the past many years, okay, that can transcend into cancer, especially the likelihood of some certain kidney disorders becoming cancerous is high with your age. Okay. With elderly patients, it is more common. So risk factors: smoking, having certain genetic conditions, misusing, overdosing, or abusing pain medications for a long time. Okay, like ibuprofen and all. Okay, even for some people, they get addicted to pain medications. Okay, but they will also have a risk of developing kidney cancer. There are certain symptoms of kidney cancer: blood in urine, that is a lump, palpable lump in your abdomen, weight loss for no reason, pain in one side that does not go away, lower back or sides, loss of appetite. So these are certain symptoms, common symptoms of kidney cancer. So you can do imaging test. Okay, you can take a ultrasonography, MRI. Okay, and then you can also go for blood test, urine test. In some cases, if a lump has been discovered, immediately take a biopsy of it, study the biopsy of it to find out if it is a benign tumor or a malignant cancer. Okay, so that's about kidney cancers. And depending on the stages of kidney cancers, different form of therapies are conducted. Okay, mixture of the therapy, chemotherapy, radiation therapy, surgical options, surgical removal of tumors or cancerous part can be done. So if the diameter of the cancer is less than 7 centimeter, it is stage 1, more than 7 centimeter, stage 2. Okay, if it expands from the kidney, it gets into the adrenal gland. Okay, adrenal gland is it's just above the kidney. Okay, adrenal glands are endocrine gland which are placed like a cap. It is like placed like a cap over kidneys. Okay, so if the cancer has spread into the adrenal gland, that is stage 3. And cancers, if they have you have found cancerous cells even in the lymph nodes around the kidneys, that is stage 4. Okay, once the cancer is inside into the lymph nodes, it can spread anywhere. That's about kidney cancer. Then you have kidney failure. So harmful waste can build up in your body. Your blood pressure will increase with that, and your body will be retaining as much as fluid as possible because your body wants to dilute the toxicity. Okay, instead of suffering from a concentrated form of toxicity, the body wants to dilute the situation away. So body will retain as much of fluid as possible, and because of this water retention, enough blood cells will not be there to work with the diluted blood. Okay, so automatically your body goes into a state of anemia as well. So this is called kidney failure. And the treatment options for kidney failure is just dialysis. Okay, as long as the person is alive, they have to undergo dialysis or kidney transplant as long as the kidneys will function successfully. Okay, not every transplantation is successful. Okay, the body may reject the organ. We cannot predict that. Okay. Then you have kidney stones. So kidney stone, it's urolithias. Okay, so it is a solid piece of material that forms in the kidney, and it cannot be passed easily with urination. Okay, and the size of the kidney stones depends. It can be as small as a small sand. A small size of kidney stone can be easily passed in the urine. Okay, and some cases of kidney stones, the size is as large as pearl. Okay, so that is big stones. So most of the kidney stones, they pass out from the body without any help from doctor. Okay, if you just improve your hydration levels, drink more water, okay, you can flush out the stone from your body. Okay, but in some cases it can get stuck in anywhere in your ureters, urinary tract, and it can cause a lot of pain. It can block the flow of urine as well. That is a painful condition in which medical aid is required. So there are different types of kidney stones based on your diet: calcium stones, uric acid stones, steroid stones, cystine stones. Okay. Calcium stones, they are the most common type of kidney stones. Okay. They are usually in the form of calcium oxalate. Okay. Oxalate is a substance made by your liver on a daily basis. And this oxalates, you get the oxalates from your diet. Okay. If you're having an oxalate rich diet, there are high chances you will develop a calcium oxalate stone. Okay. And certain fruits and vegetables and chocolate as well, nuts. Okay, they also are high in oxalate content. And in some cases, if you are overdosing yourself with vitamin D, okay, that can also lead to high concentration of calcium oxalate in your body. in your urine. The other common form of calcium stone is calcium phosphate. So that is also a more common metabolic condition. But for calcium phosphate stone is associated not with diet, it is associated with medications that you take if you suffer from migraines, seizures. Okay, so certain medications used in these conditions that can lead to calcium phosphate stones. Okay. Gallbladder stones are formed in gallbladder, kidney stones are formed in kidneys. Okay. They are two different parts of your body. Uric acid stones, people who lose too much of fluid because of diarrhea, malabsorption, or people who eat a high protein diet, those who suffer from diabetes or any metabolic syndrome, they are the people who are at the risk of developing uh, uric acid stone. Okay. Certain genetic factors can also be play a role. Okay, if uric acid stone runs in your family, you are also at a high risk of developing uric acid stones. Then true white stones. Usually it is the response of your body towards an infection, urinary tract infection. Okay, if you suffer from frequent urinary tract infection, you may develop a true white stone. Okay, these stones can grow quickly and become quite large. Okay, there may not be any symptoms or much warning about it. It can happen very quickly. So if urinary tract infection is very common, okay, every month you get 1 or 2 episodes of urinary tract infection, or it's very common for you to suffer from urinary tract infection, you have to be careful. Okay, it is white stones are a byproduct of urinary tract infections. Then you have cystine stone, and this is also a hereditary condition in which there is too much of cystine that you pass through your urine, cystinuria. Okay, that's a hereditary condition, and that causes kidneys to excrete too much of this specific amino acid called cystine. Cystine is an amino acid. Okay, it's a non-essential amino acid. Your body can produce cystine on its own. Okay, it's a protein that your body produces. So non-essential amino acids. So in some people, they excrete a lot of cystine through their kidneys. They excrete a lot of this amino acid through their kidneys, and it can condense and form stone. Okay, so that is cystine stone. So these are the different types of kidney stones. Is it clear to all? So if you have this following signs and symptoms, you may require a physician's help to diagnose kidney stones. Okay. If there is an extreme pain in your back or side that is not going away, and this is a pain that spreads. Okay, it's a sharp pain that is spreading towards your groin. Okay, it starts at your right side or left side or even a little bit further back. Okay, but you can feel it, this colicky pain, sharp pain that is spreading towards your groin region. Okay, that this is a specific pain that happens in kidney stones, and it is not reducing, it is not going away. So that is a sign of kidney stone. There is blood in urine. It means blood, your stone has blocked your urethra or any part of your ureter. It has blocked somewhere, and wherever the block has been formed, the stone is, because of the friction, stone is causing wound in that blocked area, and that's how blood is there in your urine. Fresh blood. Okay, not clotted ones. There could be fever and chills vomiting, urine that smells really bad and it looks very cloudy, okay, because of too much of protein as well, and a burning sensation when you urinate. And your meatus area is the area where urine exits your body. That is the meatus area. Okay, there's a burning sensation there. So when you have these all silent symptoms, it is known that you are suffering from stones, kidney stones. Now you have to find out which type of kidney stones, where it is stuck. Okay, when you do a scanning, MRI, USG, when you do the scanning, the exact position of the stone can be identified. And based on that, treatment will be given. Then you have kidney transplantation. In nephropathies, nephritis, chronic kidney disorders, kidney failure, in these conditions, kidney transplantation is the last resort of helping the patient. Okay. So kidney transplant is an operation that places a healthy kidney in your body. The transplanted kidney will take over the work of the kidneys that have failed. Okay, you will not no longer require any dialysis. Okay, once the kidney transplantation has been successful, there is no need for dialysis. Okay, usually the new kidney will start making urine as soon as your blood starts flowing through it. Okay, but sometimes it may take some weeks to start working. Okay. But once your body has started making urine, it means healthy form of urination has been established. It means your kidneys are functioning. And if you have a transplant, you will be put on certain immunosuppressant medications. These drugs are immunosuppressants medication. Okay, that is supposed to suppress your immunity in such a way that your body does not end up rejecting the new kidney. Okay, if you remember nephropathy, IgA nephropathy, or any form of nephropathy, your own body produces an antibody. Okay, why the antibody has been produced? It identifies kidney as a foreign object, and it will create, based on this information, it will create specific antibodies which will go and attack kidneys. Okay, so that leads to rejection of the transplanted kidneys. So that's a failure of the surgery. Okay. So to avoid this situation, immunosuppressant medications will be given. Specific kidney test. Kidneys, more than damage to kidneys, it is like you lose a lot of electrolytes from your body. You flush out a lot of healthy electrolytes and minerals from your body by drinking a lot of water. Then you have GFR, glomerular filtration rate. This is one test, the most common test to check for chronic kidney disease. And this rate shows you how well your kidneys are filtering. Okay. You have to submit your urine sample for this. So that will identify the glomerular filtration rate. Then creatine levels in blood and urine test. Okay. Too much of creatinine in your blood. Okay. It means it is not being taken away from the kidney. Okay. So the creatine is a waste product. It should leave your body. Your kidneys should remove this creatine from your blood. If creatine levels in your blood are not under normal levels, okay, it is more than normal. It means your kidneys are not functioning well. Okay. Then albumin urine test. It checks for protein in your urine. Albumin is a bigger sized protein, and if the kidneys are damaged, only then albumin can pass through the urine. Otherwise, albumin cannot. size is little bit bigger. Okay, it cannot easily pass through the nephrons. But if you find albumin in your urine sample, it means albumins are able to pass through the nephrons. So somewhere inflammation is taking place. Somewhere the nephrons are damaged. Then you do the imaging test such as ultrasound. Okay, you can the picturization of the kidneys that will help the doctor to understand what is the size and shape of the kidneys. If there are any anomalies in the kidneys, okay, tumor, okay, anything, any infections or any cyst, cavities, okay, any stone, to identify these kind of anomalies, imaging tests are required. Then biopsy, a small section of the kidney will be taken, the tissue of the kidney will be taken, okay, for examination under microscope, especially if there is any tumor or any cancerous growth that has been seen on the kidney. A section of that growth will be visualized under microscope. There's a specific way in which the kidney, normal way in which the kidney cells are arranged. Okay, but in times of cancer or benign tumor, there is a disarrangement of these sections that suggests that it is either malignant or benign tumor. So you can take steps to keep your kidneys healthier and longer. Your diet, okay, how diet plays a role in keeping your kidneys healthy. Choose the food which has low sodium, naturally low sodium. So it can avoid water retention. Okay, if you can avoid water retention, your BP will be normal. If the BP is normal, your GFR rate will be normal. Okay. Control your blood pressure. If medication is required, take medications to control your blood pressure. If you are diabetic, control your blood sugar levels. It should be between the target range. Limit the amount of alcohol that you drink if you are into any substance abuse or alcoholism. That has to be controlled. Choose foods that are healthy for your heart, like fiber-rich fruits, vegetables, low-sodium fruits, vegetables, whole grains, low-fat dairy foods. Okay, less of animal-based food, red meat, less red meat. Lose weight if you are overweight or obese. Try to be physically active and avoid smoking, quit smoking. These are the ways in which you can keep your kidneys healthy. So that's about kidney disorders. If you have any queries, we can discuss it in the chat box.